And what I think is innovative in this technology is that we inject in a precise manner when we know what we are injecting. So whether you use a cannula or whether you use a needle, that is of academic difference. I would like to use a 27 gauge long needle in this case. I can use a 27 gauge long cannula. There have been studies by very eminent professors that tell you that the gauge of the cannula is very important. I'm not sure that's the case. So with this device, if we can zoom in, you can have, you can inject the milliliter per minute. You can have an aspiration and you know exactly how much you've injected. So what we want to do, and I'm not going to reiterate about on the anatomy, Dario has explained it really well, and I really like the talk of Tapan, where he really went deeper into the various modes of injections, but we all know that the superficial temporal artery where it lies, and above the zygomatic arch, there we have the sentinel veins. So this is the hollow, and this is where the money is. So consequently, I will make a good cleansing, and I will go through skin, subcutaneous tissue, superficial temporal fascia, deep temporal fascia, and then I'm on the bone. So what I want to do, I want to aspirate until I see a bubble. Then we have the aspiration waiting time. And then the machine compensates for the aspiration and the color changes. It shows you how much we inject. So I like to inject, in her case, let me see. I think I will eject about 0. There. And now I'm going to come a level higher. I feel a resistance, and then I'm moving, and within my needle, I feel that I have a resistance. And as we saw here we've got the temporal fusion line, and we've got the superficial temporal septum. And that's also really nice because we can demonstrate that again, because we've changed our level of injection. So we are in a different plane. So this is a multi-level injection. We're now in a different plane. So we want to aspirate again until we see a bubble. We wait for aspiration waiting time. We compensate for the bubble there. And then we start injecting. And exactly we know that how much we've injected. I'm in the same plane, so I withdraw. Then I can go down here because I'm in the same plane. I don't need to aspirate, so I have the aspiration off. And I continue my injection.